And I want to say that I'm here for Dr. Mark Farfel, who has unfortunately picked up, something from his son and has to stay home sick today. And he is a person, who has made the registry into a more customer service oriented, type of thing. I mean, he would talk about the treatment referral program, which has been very involved with the World Trade Center Health Program and helping them, get people enrolled and put their applications in. So one of the first things that we do when we talk about the registry to the public is we try to say what the registry isn't, and what the registry is. The registry is the largest post-disaster registry in U.S. history, and now one of the longest running in the world. It was launched in 2002, as I mentioned. July 2002 it was funded, and is housed in the New York City Department of Health and Mental Hygiene. It is the mission of the registry to understand the short and long-term physical and mental health consequences of 9/11. We do this by tracking the health of 71,000 people exposed to disaster. I just was thinking that 71,000 is more people than where I'm from, Harrisburg, Pennsylvania, which is like 55,000. And I was thinking about, what stadium is like Penn State Stadium big enough to have 71,000 people? I don't know. Is there anything around here? I don't know. 71,000 people, it's a lot, And and they've been participating in this thing is just so important. I mean, it's just a public health enterprise of just very important magnitude, for understanding the long-term effects of 9/11. We also, assess unmet healthcare needs, quality of life, and functioning. And it's important for me to mention that quality of life is an important aspect. I think a number of papers we published recently, You've talked about quality of life, in terms of how it is associated with particular conditions people have and how it is affected. Additionally, we collaborate with the World Trade Center Health Program and other researchers and share our findings to help inform the health program's policy as well as planning for future disasters. And then actually that was one of the aims of the registry, was in terms of understanding how to respond to disasters, even weather disasters such as hurricanes, that sort of thing. We actually periodically get calls from people to help with putting a registry together, after some event. Who makes up the 71,000 people who we call enrollees? These are people who voluntarily enrolled in the registry in 2003, 2004, and completed our first major health survey. So that enrollment took place from September 2003 to November 2004. So it was about an 18-month period that we, through various media campaigns and acquiring lists of people from different organizations, including like Red Cross and that sort of thing, Volunteers Red Cross or Salvation Army lists, and that we tried to find people, and call them up and go through consent and then get them enrolled on the registry. They were exposed to 9/11, but they didn't have to be sick to be eligible for enrollment. Now that's a very important thing when you establish a registry. You need to have the full cross-section of people who are not only sick, but those who are healthy and remain healthy through the whole time that you have a registry. Having both sick and healthy people helps us get a fuller picture of the types and course of 9/11 health impacts. Now this group on the registry includes rescue recovery workers, survivors who lived, worked, or went to school in Lower Manhattan, including children, tower survivors, and Spanish and Chinese speakers, and also Polish. Actually, we found many Polish construction workers too, who enrolled on the registry. Now, they live in all 50 states and more than 15 countries. I want to mention that we have looked at, I'm not sure, I think we have somebody from every congressional district in the United States who's on the registry. And I think that just shows it's a national registry, and an international registry, because we had people who were, worked in the towers, who were from Canada, Great Britain, throughout Europe, Middle East, and those people are also on the registry as well. We don't have many, but there are some. The registry is closed for enrollment in 2004, and that's an important thing. That it's a cohort, it's a closed cohort. We often get asked, whether or not you can get on the registry, enroll on it, but because it's a closed cohort for epidemiological purposes to observe people over a period of time, you need to close it and then follow those same people for all the years afterward. But our findings are also relevant to others who are not in the registry. That's an important point. How many health surveys we conducted? Well, we've actually, since enrollment, we've conducted 3 follow-up surveys. One we conducted, and the first one, wave 2, we referred to as 2005, 2006. The third follow-up survey in 2011, 2010, 2011, and then most recently we had a fourth, 2015, 2016. And each time we do a survey, we asked, slightly different questions. We have some questions we ask every time, such as questions on mental health, post-traumatic stress disorder, for instance. We ask about symptoms in every survey. But then we also, introduce new questions as time goes on, as we learn. We want to learn about other things. The registry does not provide clinical care. But as I mentioned earlier, we do have a program where we try to help people get into treatment and get an application and give them resources, information to do that. We do connect enrollees with the World Trade Center Health Program for monitoring and treatment, as I just said. Our treatment referral team reaches out to thousands of enrollees who reported 9/11 related symptoms and conditions on our surveys. We encourage them to apply to the health program and offer help as needed. Okay, now the findings. Cancer and respiratory findings. Well, the registry has published over 80 papers. I think it's closer to about 90 now, covering various findings. Summaries can be found on our website. You can go to our website. It's easy. Just World Trade Center Health Registry. It'll pop up, and you can see, up the top, publications. With regard to cancer, the registry has similar findings to responder and survivors. Am I running out of time?
You're good.
I'm good. Thank you. I still have.
You have less than 2 minutes before.
Okay. Okay, so I'll just turn the page here. All right. What about some more? We've also heard from Dr. Reibman and others about responders and how findings suggest that persistent lower respiratory symptoms may be due to injury to small airways in the lungs. And we also have collaborative respiratory study, which she mentioned earlier, that also looked at area workers and residents and reported ongoing lower respiratory symptoms on other registry surveys, but risk of having persistent symptoms with reported intensity exposure to dust cloud. Dust cloud also remains an important exposure. Risk could also increase with reported thickness of dust in the home or workplace. We've also followed up these study participants about 4 or 5 years later to determine if they continue to have the same lower respiratory symptoms. The good news is that people in the study were largely improving as a group, although some continue to have lower respiratory symptoms, particularly those with post-traumatic stress disorder. It is common for respiratory illness and mental health conditions to occur together in responders or area workers and residents. For instance, we found that 1 in 4 of the area workers and residents and passerbys by whom have either lower respiratory symptoms or post-traumatic stress disorder symptoms had both conditions 5 or 6 years after 9/11. We also looked at asthma, where we found an increase in asthma among enrollees in the first 2 years after 9/11. We found that about 1 in 3 participants with asthma have well-controlled symptoms a full decade after the attacks. Having co-occurring conditions such as PTSD or sleep apnea contributed to poor asthma control. Children also experienced similar outcomes such as persistent symptoms, but then we also found poor asthma control among children. That was related actually to PTSD in their parents, as a matter of fact. Some also had a combination of respiratory and mental health symptoms and conditions. One of the hallmarks of 9/11 health impacts is that it's not unusual for survivors and responders to have more than one physical health condition or a combination of mental and physical health conditions related to 9/11. Furthermore, having more than one condition generally has a greater impact on quality of life than any one condition alone. That's an important thing I think we're finding as years go on, that there's comorbidity, that people have a combination of physical health and mental health, and they exacerbate each other. For the future, we plan to continue to track the health enrollees for years to come under the Droga Act, including cancer and PTSD, and potential emerging conditions such as autoimmune conditions. We will keep you informed of our findings. even as we continue to work with our colleagues in World Trade Center Health Program to build a bigger picture of 9/11 health impacts and ways to address them. Thank you.